When I talk about my oral health affecting my body and all of the things that Dr. Miller had corrected in my mouth, from fillings that were cracking that were, 30 years old, and to getting crowns, recently getting a root canal. And all of these things have given me much better overall health, and I understand how much that affects your whole body health. And but one of the things I never expected was one of the things that she saw and she asked me about was, do you snore? And 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 I told her, yeah, my wife complains about me snoring all the time. I'll fall asleep watching television program and then wake up and everybody tells me about how loud I snore. They never recorded it. They probably should have, but she asked me to take this pulse ox, little thing you put on your finger to monitor you as you sleep. And I said, sure. So I took it home and it records your pulse and what's happening to your heart overnight, and brought it back. She sent it off somewhere. There's an analysis that's done. And one of the things that it showed was that I had sleep apnea. And I didn't know, well, my wife told me that, there's times in your sleep where you actually stop breathing. And that's sleep apnea. And so this led me to go ahead and do a sleep study. And in the sleep study, they said that my heart was stopping and my blood oxygen level was going below 90 into the 80s, like 22 times a night. And so that pulse ox led me to become a CPAP wearer. And this in itself is a device or an aid that will extend your life. Your blood oxygen level won't go into critically low levels. And when this happens to you, it affects all of the organs in your body. And people don't realize it because they're sleeping. And it shortens your lifespan. So I have so many things to be thankful for from Dr. Miller, Dr. Hinds, and this Creekwood Dental office. Not only the wonderful people and staff that they have, but the care that they've given to me. And first coming here, I was approaching my senior years. I guess now with my gray hair, I'm in those senior years. But and had reasonably good care, although there had been periods in my life where I had been absent of even the 6-month dental visit. But anyhow, after being recommended by my daughter, Debbie, I came here with tooth pain that had been misdiagnosed by the dentist that I was seeing. And also this happened shortly after I moved to the Waco area and really didn't have a good feel for where I should go. But anyhow, I had an abscess. It was properly diagnosed. The technology of the equipment here was, in my opinion, state of the art. And then the care after that was, it was like, to me, it was like honey. It was love. You could feel the love and concern and care that everyone had here for everyone that walked in the door. So as I started down my journey of dental care with Dr. Miller and Dr. Hinds, I became more educated with how important this dental care is to your overall body health. and your oral health affects everything. And, even myself, I could tell that I didn't get colds as often as I used to. My body would be fighting problems in my mouth that I didn't realize were happening. And I think it's important, particularly as you age, but actually all throughout your life, that you have proper dental care and that you go to somebody like Dr. Miller, Dr. Hinds. Good luck in finding that out there somewhere. But I feel blessed. I'm very fortunate also to be raising my granddaughter, who was 3 years old when she first came here and is now 15. And I feel wonderful about her start in life and understanding what good dental care is and what it means in her life as she journeys through. I don't know what I can say other than it's been a wonderful education. I feel good about where my oral health is now.